This is my test out video for Meylogram and our lumbar puncture. So for a Meylogram, I would start by getting my patient. I would have them go and change into a gown. I'd verify last name, date of birth, if they are pregnant, any chance of pregnancy, and then if they are diabetic. Then I bring my patient into the room, get a history on them, basically asking questions like, why are we doing this exam today? And then I could also ask any history of cancers or any history of previous surgeries to the area that we are looking at. I also would ask if they are on blood thinners or if they have a history of that as well. And then I would also explain to them that there is a small risk of infection, but it is very small since we are using sterile technique. So the chances are very, very limited. Then just kind of explaining the procedure to my patient. I would explain that we are going to have you on your belly, and basically we're looking in those spinous spaces or in those, in your vertebrae in your back. And the radiologist is going to come in and he's going to clean off the site that we're looking at with either betadine or chloroprep. And we're then going to put some lidocaine into your back, and basically what that is just a number. It's going to numb you up a little bit. And then we are going to insert that contrast into your back, and that's just going to give us a visualization of where we're looking at and what we want to see. The radiologist will fluoro, and he will use live x-ray to look at, make sure we're getting into the correct spot in your back. And then we will send the patient off to a CT once we're all done with them and once we are finished with what we need to do here. So then for my prep, or what I need to have out, I'd also have the patient sign a consent form once the radiologist is in. Same with waiting to open up my trays until the radiologist gets into the room. So I have my Meylogram tray out. Hopefully you can see that. There we go. Alcohol wipes for the skin. You could also have, I know these usually come with a band-aid at the end. Bandage. So that would be for the end. A marker to mark the spot at the beginning. They usually use hemostats as well, just to mark the spot that they're looking for before they even decide to clean and prep the skin. Chloroprep, could also use betadine. It just kind of depends on preference of the rad. I'd also have a 10 milliliter syringe out, and that's what we're going to use to insert our lidocaine. And then here's my little lidocaine bottle. I have a 25 needle, 25 gauge needle. That's going to be for the lidocaine for numbing, and then my Omnipeg 240 for inserting that contrast. And that would be for a lumbar spine. And then for cervical, they sometimes use 300, but kind of depends. And then I'd have a 20 gauge needle for that. And then the only difference, so if we're doing a Meylogram versus lumbar puncture, I have a lumbar puncture tray right here. So then I get that out, and the only difference is we are pulling spinal fluid from the spine for these ones. So I would also need patients' stickers or their labs, and then I also want to have a biohazard bag, sticker, all that stuff ready. But otherwise, the other stuff is the same. This would be my setup. I have a pillow, especially if we're doing a myelogram and inserting that contrast, we want to keep the head raised up so to prevent that contrast going into the breaking the blood-brain barrier. Had a sponge down. My thing went to sleep. And then I have my myelogram and my fluoro tab pulled up. And I think that's about it.